Good morning. This is David Henry. I'm the Communications Manager for the City of Amarillo. I want to welcome everyone to our weekly news conference for the latest in COVID-19 information for the Amarillo community. Let me go ahead and briefly introduce who is on our panel today. We're joined by Amarillo Mayor Ginger Nelson, Casey Stoughton, Public Health Director for the City of Amarillo, Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital, Dr. Michael Amentier, Chief Medical Officer for BSA, Dr. Rodney Gonzalez, Director of the Amarillo VA, and City Manager Jared Miller. We'll open it up to our panel to make some brief statements, and then we'll take questions from our media here in our attendance. We'll start with Amarillo Mayor Ginger Nelson. Mayor, how are you this morning?
I'm doing well, Dave. Thank you. And good morning, Amarillo and the Panhandle area. Probably out your window, it looks as beautiful as it does out mine. Beautiful snowstorm yesterday, despite the chaos that it's created for some of us. It is good to just stop for a minute and take in how beautiful it is. This morning, really all I have to say is that I'm so grateful. We were talking before the conference started about how long we've been doing these press conferences and that we'll soon be coming up on our 1-year anniversary. And there have been many times in the last year where we've felt helpless to change what was happening around us. But we've continued to persevere through it. And you guys have all been on that journey with us. And through the last year, we've learned some things about how to handle a pandemic, how to work together as a team. And it's so wonderful. And I'm so grateful we're finally seeing results from all of that. We're seeing our numbers go down. And I want to say thank you. Thank you to every business owner. Thank you to every citizen who is following guidelines and learning how to live in a pandemic in a way that can reduce our numbers. Thank you for wearing your face masks. Thank you for planning your events with social distance. Thank you for washing your hands more often. It's working. So we have some good news this morning about our numbers, and I'll let the doctors and the city staff tell you about those. It doesn't change where we are with the governor's orders. We're still under orders to wear a face mask when we're indoors and not in our homes with our families. But if anything, I want to encourage you. We are a team. And we're seeing our teamwork make a difference, whether that's in our pandemic numbers, our COVID numbers, or even just like yesterday in response to this winter weather when we, as city leaders, stepped up and asked you guys to reduce your energy use, reduce your gas usage. Reports this morning from both XL and Atmos Energy are they've seen a drastic change because of that call to action, and that's because of you. So we have learned what it feels like to be helpless, but when you persevere and you learn what needs to happen in order to change the situation, then you can actually see results go in the direction that you want them to. And I think that's the report this morning on the COVID-19 situation. That's the report in our response to the winter weather. And I just want to say thank you. Thank you to every Amarillo resident. Thank you to every Panhandle resident who responded to that call to reduce our energy last night. Let's keep that in place for a couple of days and see the weather get warmer and keep pressing on and persevering together as a team. So I just want to say thank you. Thank you to every one of you. And thank you especially to the people on this call and the teams that you lead who are helping us succeed in this situation. That's what I have this morning, Dave. Thanks.
Thank you, Mayor. Let's now go to Casey Stoughton, Public Health Director for the City of Amarillo. Casey, how are you today?
I'm good, Dave. It's a little chilly. We turned our thermostat down yesterday to about 66, 67. So I'm coming to you from our bedroom. I have my ironing board out this morning that I'm using as a desk. We're just a little chilly. It's okay. We want to do our part, not only in the pandemic by wearing our masks and socially distancing, but also by turning our temperature down and being wise in our energy consumption. So we're all in Amarillo and all in for whatever the emergency is. And so I'm glad to be part of that team. So thank you, Dave. I'm glad to be here this morning. Just this morning, Amarillo Public Health and the City of Amarillo were able to bring the status level down from red to orange. So it's a good day. The indicators established as parameters for our status levels are currently all in status level orange, with adult bed utilization at the hospitals at 75.5%, ICU utilization at 78%, ventilator utilization at 28%, and our 5-day new case average right around 45 new cases per day. We will be at this status level orange for for 2 weeks, and at that time we'll reassess and either stay at orange or appropriate level. Yesterday, our GA32 hospitalization percentage was 7.65%, meaning that 7.65% of all hospitalized patients have COVID-19. Our RAC region is no longer considered an area of high hospitalization. However, it is critical that we continue to wear our masks, socially distance, and wash our hands really good, as the hospitalization rate and the infection rates are fragile and depend on the choices that we make to remain low. While we have moved to the status level orange and are no longer an area of high hospitalization, I do want to talk about the numbers this morning. As of Monday, there were a total of 32,785 total cases of COVID-19 reported in Potter and Randall County, 16,730 cases in Potter County, and 16,055 cases in Randall County. We have a total of 30,830 cases recoveries, and that is excellent news, but we are up to 661 deaths here in Potter and Randall counties. That leaves us with 1,294 active cases. Each of the cases do represent a unique individual. We will not have a 2:30 report card today, as city operations are currently closed. We will catch up with a bolus of data when the city operations resume, both as on a report card level and on the city dashboard. The public health drive-through testing site does remain closed until temperatures are safer for staff and patients, or both the staff and patients. The outpatient bamlanivimab infusion center will accept referrals from local providers once the city operations resume as well. So far, we've seen 145 patients, with 4 requiring hospitalization. So great results through that operation. The vaccination clinic is also closed until city operations resume. And as of Monday, we had given a total of 40,263 first doses and 17,693 second doses, for a total of 57,956 doses of the received 66,950 total doses. So a lot of vaccine has been given through the Civic Center, and we sure appreciate all of our partners. Most of the vaccine has been given locally. So 82.8% of the vaccine has gone to people living in Potter and Randall County, with 96.4% of the vaccine given to people who live in the Texas Panhandle. 3.6% of the vaccine has been given to people who live outside of the Texas Panhandle. So as you can see, most of the vaccine has been given to people who live right here at home. I want to take a moment just to mention our WIC department. Their offices will also remain closed today and tomorrow. However, conditions pending, they're planning to be open Friday and Saturday. And that is all I have today, Dave. Again, I sure appreciate our community and being part of this wonderful team. Thank you.
Thank you, Casey. Let's now go to Dr. Brian Weiss, Chief Medical Officer for Northwest Texas Hospital. Dr. Weiss, good morning.
Hey, good morning, Dave. So I think I'm thawing out. I'm pretty sure I felt my toes this morning. But I do, I'm guessing that my friends in city leadership have found it refreshing to have to deal with a crisis that is not related to COVID. But I do want to thank the mayor and the city manager and all their incredible leadership over, again, a unique challenge over the last couple of days, over these last 12 months. So it's good to be, hopefully, on the backside of this cold front. With regard to COVID, I was listening. So apparently 48 states in the United States now are reporting decreased numbers of positivity for COVID-19. That's very exciting. In fact, they were saying this morning that we've gone from over 250,000 new cases a day down to about 85,000 new cases a day in the United States, which is great. Okay? This is what we're looking for. But one of the experts I heard this morning was saying, the question was, are they still concerned? And the answer is yes, for 2 reasons. One is the variants. We know that these variants are spreading, and particularly that UK variant, they're anticipating may be the dominant strain of this virus in the United States by about mid-March. and these just much more aggressive in terms of spreading, even though we still believe that the vaccines will offer protection from the variants at the current time. But the other concern is the fact that a lot of places are starting to reduce their restrictions on masks and social distancing. And again, that's going to be an opportunity for this virus to take advantage of us if we continue to do that. So again, we got to keep our alerts up and keep our guard up as long as we continue to distribute vaccine and get past this vaccine, past the virus. I guess, the good news is, at Northwest, we were dealing really with two major plagues. Obviously, COVID-19. The second is these black birds in our trees. I have not seen a single black bird in our trees for 48 hours. Okay, so we have a very talented associate administrator, Justin, who's been working on this for several months, just trying to get rid of the swarming birds. And I think, in the old classic saying that if you try, you will succeed. I think Mother Nature is helping, Justin, and so far the birds seem to be gone. So we've had reduced birds, reduced COVID. That's great. So in regards to our numbers, we have 203 patients at Northwest. That's a low census for us on the acute side. Out of those 203, we have 25 patients with COVID right now. That is 5.1% of our total licensed beds. So way below the 15% governor's limits. Right now, we have 43 patients in our ICUs, 12 of which have COVID. We are currently using only one ICU to take care of COVID patients. Again, big change from previously. We do have a young person in our pediatric ICU who has COVID. And again, we've been asked the question about, well, who does COVID affect? And here too, we've seen this is a young person below the age of 18, otherwise healthy, who has gotten sick enough to be required to be put on a ventilator. So we know that COVID is indiscriminate. It can affect anybody, and why all of us need to be very careful about this. Right now, we are using 11 vents total in the hospital, 7 of which are going to patients with COVID-19. And up to this point in February, we have had 15 persons lose their life to this virus. So that puts us on target for coming in at less than 30 deaths for the month of February, which would be great. Again, comparing that to 70 plus in November and December, at the worst of the surge. And right now, we only have 10 staff who are quarantined due to exposures to COVID-19. In regard to remdesivir, which is the inpatient drug that we've been using, we've treated 721 patients. We have 4 on treatment right now. And as Dr. Amentier mentioned a couple of weeks ago, there were questions about how effective is this medication. And I was part of a team the other day looking at this. And again, it is no miracle drug. That is very clear. And there may be some very, very succinct or distinct populations that benefit from this, but it proves to be something that we know is not hugely effective, but certainly we continue to treat because that's about all we have, that and Decadron right now. The bamlanivimab, right now we have about 330 doses available, and that's the one that's an outpatient treatment. Again, for those patients or people who are positive, who think you might be eligible for this in terms of being in a high-risk group, please seek the care of your primary care doctor or another physician for a referral to the city center for this infusion, because it can be very effective in the right people. And lastly, it's interesting, we still have had 0 influenza in the hospital. And I reported that last week we had 1 case of RSV, which is the virus that affects mostly kids. And now I found out that we think that may have been a false positive. So we've had 0 cases of RSV. Usually influenza and RSV are ravaging communities by this time of the winter. So incredible how these precautions for COVID have prevented these other common viruses from taking hold. Last thing I say today is please, as Dr. Amentier said frequently, and everyone on this panel, please consider getting a vaccine. When your time comes to get the vaccine, when you have that opportunity, please seek that vaccine. We have the most efficient system in Amarillo, thanks to Casey and the Public Health Department, and it's easy to get that vaccine. And I think it will offer protection even as we face the threat of these new variants from COVID-19. That's all I have for today. Thank you so much.
Thank you, Dr. Weiss. Let's now go to Dr. Michael Amentier, Chief Medical Officer for BSA. Dr. Amentier, how are you this morning?
I'm well, David. Thank you, and good morning, Amarillo. It's good to be here today, and everybody here has braved the cold to get on this news conference and come to work, and everybody, our teams at the hospitals and the folks that are coming to provide care for our patients have been doing things to really help others out with four-wheel drive vehicles getting to work for those nurses and staff that had difficulty leaving their homes. So we appreciate that and the ability to continue to care for our patients here, obviously. As I was shoveling snow close to midnight last night with my wife on our back patio to let the dogs out, and she gets on my back about that, making sure that our dogs can get out and take care of their business, which is obviously necessary. I said to her, this is the reason I left the Northeast, so we didn't have snow like this on a regular basis. But it's nice to see every now and then. It is pretty until you have to pick up the snow shovel. That's what I would say. As far as where we are today with our numbers, we have remained fairly steady at about 30 to 35 patients in the hospital over the past 1 to 2 weeks. And we've kind of hit this little plateau at a thankfully a much reduced number of COVID inpatients, but we've not been able to drop lower than right about this range of 30 to 35. And I think Dr. Weiss mentioned as well on our recent discussions that they're hovering almost an identical number at Northwest, which I think is interesting. What I would say is that of those 35 we have in-house today, about half are requiring the intensive care unit, 16 of those, and half of those 16 are requiring the mechanical ventilation assistance because of respiratory failure. Right now, we're at 11% of all of our admissions are due to, all of our hospitalized patients are due to COVID-19. That's 35 out of 316. And we're about 8% of our licensed beds are being occupied by COVID-19 patients, which again is significantly lower than where we had been historically. We've been able to send the bulk of our ventilators that were provided to us by the RAC back because we're not relying on a large number of vents at this time. Only 15 patients total are on ventilators in the hospital, and we have plenty of capacity there at this time, which is good. We are back into the historical ICU as we know it, which is our 48-bed intensive care unit. And we do have some ability to flex into our intermediate care unit for additional ICU beds if needed. And fortunately, we're keeping numbers where we can stay in the primary ICU for the most part at this time. Our testing numbers have markedly diminished. We're down in February month to date to only 5.8% of all tests that we're doing for COVID-19 are coming back positive. As you may recall, I said that number was about 13% in January, and it was about 17% of all tests we performed in December. November, as you recall, was about 34% of all the tests we were doing were coming back. So a third of those tests were showing positivity. So we've really turned a significant corner there. If you ask any of us, I think on this panel, what we think the reasons are for our dropping numbers across the community, I think it's multifactorial. Number one, ongoing and improved efforts at masking and ongoing social distancing are critical. There's no question in my mind that the vaccines are part of the reason why we're seeing the drop off in numbers. And then obviously, I think because of the mild herd immunity we're starting to see, and I say the word mild, I would say the presence of some herd immunity is also part of the reason why our numbers are dropping. There was an article that came out in Science recently that was a nice summary of where we are and where we've been over this past year. And one of the questions that we've had is whether vaccination will help to prevent the spread of disease by those that are vaccinated. Obviously, if you're vaccinated, the risk of you acquiring disease is far, far less. But can someone who's vaccinated and is asymptomatic potentially spread disease? There were some studies that were done, and specifically looking at the AstraZeneca vaccine with the Oxford group. And it looks like the potential to spread virus, and this is a little bit of a guess based on what some of the numbers that they've shown, it looks like that potential was reduced by about 50%, meaning those people that were asymptomatic, that were vaccinated, they were testing these folks weekly in one of these studies, and there was about a 50% reduction, they believe, in the ability of those individuals to transfer the virus. Now, again, some of that's theoretical, based upon positivity in a non-vaccinated group who were asymptomatic compared to these folks who were vaccinated. But I think it just goes to show that the benefits of vaccination clearly are not just to protect you, but obviously to protect others. Similar to why we're wearing masks. You're wearing a mask not just to protect yourself, but also to protect others. And it's the combination of these things that are going to help get us where we need to be. Think about where we were a year ago, where we really had a lot of question marks. We had a lot of unknowns, and how much we've advanced here in a year in terms of now we have multiple vaccines. We've had an outstanding brisk vaccination campaign in our city. We're being recognized across the state and also across the country, quite frankly, in terms of how successful that has been. So we need to give ourselves a little bit of a pat on the back because of the collaboration across our community and the medical community and the city of Amarillo leadership, the public health department, in terms of what we were able to accomplish. But we can't rest on our laurels. We have a lot of work ahead of us in terms of what we're going to do to continue to roll out vaccine, how we're going to assist the state with some of the upcoming plans to probably have to handle multiple additional types of vaccines, and then also continue with therapies like the monoclonal antibodies for patients that are at higher risk, and decide what medical therapies are going to be most efficient and best to use in the hospital setting. As Dr. Weiss mentioned, and we agree, and I brought this up a week ago, is that we really want to make sure we're using the most efficacious medications in the hospital. We want to make sure that we're doing things that we have some evidence that are beneficial. And although there is some concern about the scope of patients that are getting remdesivir because of its mild efficacy, it doesn't mean we're stopping the drug. It means that we're being more careful about who we're selecting to receive the medication. And please remember, if you are someone that has risk factors, or your friend or family member or whomever it is that you know was recently diagnosed, if they have risk factors and qualify for monoclonal antibody therapy, you've got to get them to contact their PCP so they can get scheduled for that therapy. We are doing that at BSA Urgent Care. And again, I know Northwest is doing some of this therapy as well in equivalent fashion. And we are in the city, obviously, and we are helping to support that initiative so we can prevent hospitalizations as much as possible. So last thing I'll say is I will concur. You probably are curious about our influenza numbers. Essentially non-existent. I mean, we have a few flu cases, but very, very few. I had a discussion with some of our local pediatricians on medical staff today, or this week, I should say, and they were remarking about how the dramatic reduction in influenza cases and RSV cases in their offices, and how it's really almost certainly secondary to the masking and social distancing that we've been employing here. It's amazing how those things can reduce the incidence of respiratory disease. So I want to thank everybody, our staff at both hospitals, nursing staff, medical staff, who continue to work at long hours and continue to really get us through these difficult times. Fortunately, the burden is starting to relinquish a bit, and I'm hoping that we're all going to have an ongoing improvement this spring as spring comes to us in the next month, and we see that hopefully case counts continue to diminish. Thank you.
Thank you, Dr. Amentier. Let's now go to Dr. Rodney Gonzalez, Director of the Amarillo VA. Dr. Gonzalez, how are you?
I'm doing well, Dave. First of all, thank you for this opportunity. Just to get into our numbers real quick, we only have 2 hospitalized COVID patients. Neither one is in the ICU. They're both on our med-surg ward. We have vaccinated over 18% of the veterans that we take care of across our healthcare system. And so just really appreciate those veterans for coming in and getting vaccinated. And we've also vaccinated a little over 700 of our employees. We've talked a lot about the positivity rate. And so I went back and looked at last week what our positivity rate was on veterans that have been vaccinated or that got tested for COVID virus through many of our different platforms and for various reasons. It was only 1.6% last week. And so truly a move in the right direction. And once again, it is because of the many things that we have going on. It's wearing your mask, it's the social distancing, it's the good hand hygiene, it's staying home when you're ill. But as Dr. Weiss said, it's also that vaccine. Whether you've gotten the vaccine from the community, through other sources, or here at the VA, that is not just protecting you, it's helping to protect that community through that herd immunity that we've spoken about in the past. So something I want to comment is the winter storm impact. It has affected our healthcare system, not just here in our Amarillo campus, but all of our campuses. So as a result, we've had to move almost all of our appointments to a virtual method through this week. Do apologize for veterans for the inconvenience. If you're not sure, please call, talk to our team, make sure you know. I would hate to have you out in this weather and in these road conditions if the appointment got moved to virtual. Our emergency department's still open and our vaccination clinics is still open. Now, I do know some veterans may not want to get out, even if you have a scheduled appointment for our vaccine clinic. So please call, let us know. We'll get that rescheduled to a time that works better for you. But it also allows us to make sure to have enough slots for anybody who can or desires to come in. Once again, our number is 806-355-9703 and then press option 2. Do want to encourage all veterans to get vaccinated. As mentioned, the city is doing an outstanding job in running their vaccination clinic, leading the nation in efficiency and ease. And so I know some veterans and many veterans are going there. And so please, if that's easier for you and you want to get vaccinated there, please do. Please call, let us know so we can make sure we update your records with that. With that, I want to thank the city. Oh, actually, I do want to give a quick shout out to our engineer team. You know, I drove in, and this is nothing against the city, but the best roads were here on the Amarillo VA campus. And so, sorry, Marineros, I'm not trying to call out you or Jared, but did really appreciate what our engineer team is doing and the work they do constantly through this winter, but what they do for us each and every day. And so, with that, thanks for this opportunity, and have a great day.
Thank you, Dr. Gonzalez. Let's now go to City Manager Jared Miller. Mr. Miller, how are you today?
Doing good. Thanks, Dave. I would definitely want to echo what Dr. Gonzalez was saying, and I'm sure all the doctors and the mayor and Casey and everyone on the team would echo our appreciation for all of our team that's working outside in these challenging conditions. I've gotten this morning pictures of our plumbing and water distribution system team in wet holes at night, working on broken water mains. So they're doing a lot of good, hard work. All those teams that are out there moving snow off the streets, all that stuff. Of course, we want it done faster, but they're working hard. So to all those people out there working in these challenging conditions, doing very necessary jobs, we all express our thanks to that. Obviously, we have weather impacts on operations at the drive-through testing site because of the temperatures. Also at the Civic Center for the vaccination site because of energy supplies. So we will notify the public as soon as those things go back into operation. We certainly expect that no later than next week. And if we can do it sooner, we will notify everyone about that as soon as we can through our social media, through our website, through our media partners who are on this call as well. As soon as we do go back to those operations, we will be providing free transportation to both of those sites. But at this time, those facilities are not operating. We are also, well, just to remind everyone, we are still subject to the governor's executive orders GA-29 and GA-32. GA-29 does require all of us to be wearing face coverings when we're out and about, when we're at our businesses, when we're in social gatherings or gatherings with people who are not family members, anytime we're not social distancing. Also, GA-32 does allow all of our businesses to be, and our restaurants, our stores, our businesses to be open at up to 75% capacity, with the exception of bars that are limited to 50% capacity. We are also all subject to, in addition to the governor's executive order, also state statutes that do require our businesses and our citizens, as we're out and about, to be wearing face coverings. So we want to be very diligent in that. That is, as the doctors have said, and as our medical professionals have said, one of the key things that's enabled us to be in our very advantageous or very beneficial position relative to where we were the last few months. So that's all I have, Dave. I'll answer any questions that anybody has.
Thank you, Jared. I'm now going to go to members of our media who are in attendance. If they have a question for an individual panel member or the panel as a whole, that's completely fine. Let's go ahead and start with David Gay at the Amarillo Globe News. David, how are you today?
I'm good. Good morning, everybody. I guess my first question, I know I asked this last night at the news conference surrounding energy, but I thought I would ask it again. what if does the city plan on remaining closed throughout the remainder of the week for the weather, or does it just depend on whether or not conditions improve?
Mayor, I'll jump in and you can fill in any blanks. We, at the request of Atmos and of Excel, based on the demands, not just here in the region, but statewide demands, energy demands for gas primarily, both for generation and for residential heating, we are all requested by Atmos to dial back our temperatures, or well, not just Atmos, but Excel as well, to dial back our temperatures, to do everything we can to reduce the demand on our energy supplies statewide. You've noticed that many of you, if you have relatives, if you have family members or friends in other cities, for example, in the Austin area, there's many people that have been without water and power for over 3 days now. So we're in a much better position there. We've had a few very temporary, very brief outages on the electric side. We have not yet had any shortages or outages on the residential gas side, but those are all very real risks. So we have been asked to be able to extend through the rest of the week on that, and we will. Certainly, if we are in a position to be able to open back up, say for Friday, we will communicate that out immediately. But that's what we've been told. That's the way the situation's been described to us by our energy partners, and we want to make sure that we respect that.
Absolutely, absolutely. And I guess with that, just a follow up for Casey, because of that, for the COVID-19, or whether it be reporting through the report card or updating the COVID-19 dashboard on the Amarillo Alerts website, will the numbers from all the days that the city was closed, so I guess Tuesday, Wednesday, Thursday, Friday, will that all be, I guess, come together in a report card whenever the city opens back up?
Yes, it may take just a little bit of time to have all of the data entry completed, but all of that will be caught up once operations resume. Yes.
And can you tell me, I guess the hospitals wise, has the ongoing weather situation affected, I guess, your operations, whether it be with general care for patients or care for those COVID-19 patients currently hospitalized?
I can start there. The weather has not affected the care of our patients. It's a good question, but no, we've been able to obviously operate here without too much difficulty. Fortunately, we did not have any loss of power. The hospitals, I think, are at the bottom of the list as far as any kind of rolling blackout plan if that was critical. Certainly, we could lose power. Anybody could lose power, and we do have backup generators. So we were preparing for that potential scenario. Fortunately, we did not have to deal with it. We are prepared to deal with it if it happens from this point forward until we get warmer temperatures, obviously. And then I think some of the things that we see routinely, we did have one fire sprinkler pipe burst this morning in a non-patient care area that our facilities team very expertly and our EVS services expertly took care of and cleaned up quickly. So the typical things you'd see when you have extreme temperatures like this, I think, as I mentioned earlier, the staff that don't have four-wheel drive vehicles, we did have to transport some of them last night with some of our co-workers who were able to donate their time and effort to do such, which we are very appreciative of, and got those individuals to work. So that's some of the things we see typically with our snow plan that we try to prepare for with these types of things.
Yeah, I would say the same in Northwest. Same thing. We've had some staff that had to stay overnight in the hospital just because they were unable to get home safely, and we would be able to accommodate them. As Amentier said, we do generator tests every month for exactly these kind of situations, so that the hospital is ready to switch over to generator power, within seconds if there's a break in energy. I guess our biggest challenge is, as a trauma center, every so often we get patients who have suffered an injury that may need a surgery subspecialty that we don't have available. Maybe we need to transport those patients to UMC in Lubbock or maybe to the Dallas area. And that's our only concern right now is just our limited ability to transport a patient to a higher level of care if need be. And hopefully that will change very shortly here.
Absolutely. That's all the questions I have right now. Stay warm, guys.
Thank you, David. Let's now go to Dalton Williams at KVI Channel 7. Dalton, how are you today?
I'm good, thank you. So my first question is, with the energy conservation, has that impacted the storage of the COVID-19 vaccine at all?
No, so that the vaccine is secure, and we have monitors on that will call us in the event that anything happens, if the temperatures go below or above where they need to be. And then we have a contingency plan worked out with our hospitals in the event that the temperatures do have, it's called a temperature excursion. So if there's a temperature excursion, then we do have a backup plan. So
we've also worked with, Casey mentioned the hospitals, they're on protected circuits. We don't, for emergency management purposes, when the power companies do, for example, what happened yesterday with rolling blackouts, the hospitals are not subject to those for emergency management and operational reasons. We've also worked with Excel to make sure they're aware of the vaccines being stored at one of our facilities, to make sure that we can do what we can to protect that circuit as well, for obvious reasons. But we've also taken additional steps to make sure that we have generators and backup power available, and, as Casey said, contingency plans if something happened to the power supply at that facility.
Okay, awesome. And then since we are in level orange right now, what are the kind of specific requirements that go into meeting the requirements for level orange? Like what are we doing? What are we like? How did we get to level orange, like, specifically?
So those indicators for level orange would be an adult bed utilization between 60 and 79%, ICU utilization between 60 and 79%, ventilator utilization between 49%, and a 5-day new case average between 50 and 79 new cases per day. And most of those indicators are on the Amarillo Alerts dashboard, all except the 5-day new case average. And we announced that 5-day new case average on the city council meetings and on the press release every Wednesday. So those indicators are all accessible to the public through the Amarillo Alerts dashboard.
And I think it's important to note, this is more an indication of what our condition is here. It doesn't change the steps that our community needs to be taking relative to face coverings, relative to any of the governor's executive orders. All of those things are still in effect, and we do need to be observant of those when we're out and about and when we're interacting with people, especially inside 6 feet, all the social distancing, et cetera. It really is a description of what's going on in our 2-county health district area. That's what our color system addresses. Then you have the 25-county area where you have the governor's, a trauma service area where the governor's calculation of hospitalization rate is in effect. So they describe 2 separate things. So it really just gives you a good, real quick snapshot of what's our condition right now.
Okay, awesome. Thank you so much. That's all the questions that I have today. Thank you for letting me be here.
Thank you, Dalton. Let's now go to Aaron Langston of KAMR Channel 4. Aaron, how are you today?
Pretty good. How are y'all?
Good.
First question is with the vaccine clinic closures the past couple of days and potentially the next couple of days, are we looking at a possibility that our vaccines may expire that we do have?
No, the vaccines are stored properly, and the vaccine will not expire anytime quickly. There's a fairly decent shelf life there, and so we're not at risk of that vaccine expiring.
And in addition, I know that Casey and her team have done an excellent job communicating with DSHS and the vaccine allocation panel. Obviously, everyone knows there's been a major weather event across the entire state, but we haven't taken it for granted, and we've been intentional about communicating with them, because what we don't want is for vaccines that are sitting on our shelf to be held against us when they make an allocation decision for the coming week. So we've been over communicating about all of that as well.
Alrighty, and that answer kind of ties into my next question. Has the weather impacted any vaccine shipments that we were scheduled to get?
No, and we've been keeping an eye on that. I check the website just probably, I don't know, several times a day to make sure that we don't have any shipments pending. And so far we do not. So the answer there is also no.
All righty. I think that has me covered. Thank you very much.
Thank you, Aaron. Let's now go to, if I'm not mistaken, Kevin Welch of News Channel 10. Kevin, how are you today?
Hi, Dave. I'm good. So, Casey, just to be sure about what Jared said, the Amarillo alert says the clinic is closed all week. And is that because of the energy issues?
Yes, sir. That's because all city operations, or those non-essential city operations, are currently closed to conserve, to be, part of the team that's conserving those utilities.
Okay. Just wanted to be sure. Thank you. How much supply of vaccine will the city clinic have when it reopens, and which doses will those be?
So we have just over 3,200 first doses and just over 5,000 second doses.
And doctors, with less than 100% effectiveness for the vaccines, what can people expect if they've had both shots but still catch the virus?
I would say a couple things to that. Number one, remember that the messenger RNA vaccines are demonstrating extremely high efficacy rates, greater than 90%. So that is astounding, number one. Number two, when we talk about the variants that we're concerned about, and as Dr. Weiss mentioned, the UK variant potentially being the predominant strain here as early as mid to late March, and I have seen similar commentary from experts that are suggesting that possibility. The vaccinations still are felt very strongly to prevent against severe disease, even with the variants. So if you're vaccinated and you still get sick and infected by COVID-19 or with one of the variants, the chance of you having a severe infection that leads to pronounced respiratory failure, obviously hospitalization, potentially death, should be dramatically reduced. There's still a lot we don't know about this area, obviously, and some of this is speculation, but it's speculation by the virologists and scientists that have done a lot of research to this point in this area. So I think we need to trust what they're saying in terms of their estimates, and also the data that so far has been put forth. So again, we have seen a dramatic reduction in quarantines of our staff here at BSA. Today, I think our total was 7 staff only quarantined. And of those, only 2 of those are nurses. So the numbers have dropped off dramatically for us for multiple reasons, but one of those I'm certain is because of vaccination. And it's not just your antibody levels. I think some of the concerns with the variant mutant viral strains that we're seeing, some of the concerns are, well, if the vaccines produce antibodies against the spike protein, if those antibody titers, number one, if they wane, or number two, if the viruses have found a way around evading those antibodies, you still have to remember that the vaccines are generating a T cell response. And the T cells are part of our immune system, white cells, that help us develop antibodies in a more rapid production that can also assist, again, in preventing those severe infections. So it's more complex than just a simple antibody response. And I think there's still a lot we don't know.
Yeah, the only thing I'd say is we keep stressing with our staff is that mostly nothing has changed whether or not you have a vaccine or not in terms of wearing a mask, social distancing. Just last week, the CDC made the first recommendation that would differentiate someone with the vaccine and someone who does not, which said that in someone who's received the vaccine and they're at least 10 days post their second dose, if they have a moderate or high risk exposure, the recommendation is they do not need to quarantine like someone who does not have the vaccine. But that is the only differentiation we've seen officially with regard to recommendations of those who have vaccines and who do not. But again, as Dr. Amentier said, the biggest thing is even after the first vaccine, by about 14 days after the first vaccine, they've been able to show that people do not get as sick when they contract COVID-19 as those who do not have the vaccine. So it's very clearly a strong protective effect in terms of critical or severe illness.
And
Okay,
Kevin,
thank you.
I would like
Yeah.
to just make a point there. The person has to be 14 days after their second dose. It has to be within 90 days, so it can't go past 90 days from their second dose. And they also have to remain symptom free. So if they get symptoms during that time, then they have to quarantine. So they have to remain symptom free the whole time that they would be in quarantine, for them to not have to quarantine. So there's a lot of pieces to that guidance. Public health and the hospitals are working with their teams for sure. We're working with the fire department. There's a lot of pieces to that, but there's definitely some caveats. So it's not just a blanket, you don't have to quarantine. There's a lot of pieces to it. So if you need more information on that, we're happy to make sure that you have that.
Okay, thank you. And somebody from the city, I'm not sure who, have you seen any results yet from the outreach to diverse communities like refugees, Hispanics, Blacks?
We've had a lot of traffic and a lot of interest in the website. So there has been, with the targeted Facebook campaigns and the targeted advertising, there's a lot of clicks back into the Amarillo Alerts website. It'll take us a little time to enter all of the data to see kind of if there was a change in the percentages of people being vaccinated. But I will tell you that it's really wonderful to be at the clinic and to see just the wide variety and the wide cross section of our community that is there at the clinic. It's really a hopeful and a joyous place to be. I think it's one of my very favorite pieces of this response is to serve at the clinic. I love people, and so that's probably another reason why I love to be there. But it really is nice to see just the wide range of people who are at our clinic.
Okay. And I guess the last thing is, Casey, again, what criteria has to be met to move to the next vaccine level? I know you're on that advisory council.
So the state has that decision has not been made yet. The EVAP committee will start talking about that and making those decisions, but the next group of people to be vaccinated has not been decided at the state level.
Casey, just give the numbers statewide for how many people are in category 1B, Casey.
Sure. So there's about 8.4 million people in Texas that are in the 1B category. And so far, I think last week they said that there was about 3 million Texans who had been vaccinated. So there's still some work to do, both locally and across the state of Texas, for people to be vaccinated in the 1B category. So, it's important for us to know who's next, but it's also important to make sure that everybody in that 1B category has an opportunity to be vaccinated. So the conversation will still, is still ongoing. We'll start talking about that in the EVAP committee. Our meetings are each Monday. We did not have a meeting this Monday due to all of the power outages and weather that were occurring statewide, but we will take that topic up soon.
Okay. I mean, I know you don't make the rules, but is there a rule that says 90% of these 8.4 million or 85% have to be vaccinated before we move on?
That's a good question. There's not, and when we move to, from 1A to 1B, it's kind of like, it wasn't a hard stop. It was more like a wave. So before one wave was finished, we kind of started on the next. So I can't answer that for sure. I would imagine that we won't have to finish all of 1B before we move to 1C or 2 or whatever the next group is called. But I think that there does need to be an opportunity for the 1B group to be vaccinated. So more to come on that. I'll certainly share what I have when I have more information.
That's great. Thank you. That's all today. Thank you all.
Thank you, Kevin. That concludes our questions from our media today. This also concludes our news conference for today. I want to thank all of our panel members who took the time to join us and provide this information to the Amarillo community. Once again, we do this every Wednesday at 11 a.m. This is David Henry. I'm the communications manager for the city of Amarillo. We'll see everybody next week. Thank you.
All right. Thank you.